Around here, we live for sports.
Stick it out there!
It fills our autumn Sunday afternoons and our winter and spring nights. And when autumn rolls around once more, high school football defines our Friday nights. The hard-hitting drama is in our blood and it's knit into our bones. But as any mother fretting in the stands will tell you, too often Friday night lights can turn into Friday night lights out. Concussion.
You get a little bit of everything. You get bell rung, you get dinger, you get a head rush, you got your head exploded, whatever.
When there's a concussion, there is like a firestorm in the brain because the chemicals are all scrambled out. And then the brain needs time to get that back together.
Tell me when it starts to become two.
It wasn't so long ago a teenager with a concussion was patted on the back, given a few days of rest, and sent back into the game. But the science of concussions has come a long way since how many fingers am I holding up and what's your name?
We've really reached a point where we have a very, very firm understanding of when kids can go back to play, and it's based upon science.
Go ahead and turn towards the TV screen.
Now, doctors here in Pittsburgh are at the leading edge of research into concussions, why they happen, how they affect the adolescent brain, and most important, how concussions can be managed and treated. New approaches are giving hope to high school athletes who find themselves off the field and, in a way, out of their lives.
I worried a little bit that I might not ever get back to playing. I might not fully be able to go back to school, that I wouldn't heal correctly, and I would be a different person at the end.
Recovery looks a little differently when you start using all these different aspects of assessing this injury.
The newest study and treatment lies in the hands, increasingly, of neuropsychologists, whose therapies address problems in vision, balance, and thinking. The goal is to heal student athletes and safely return them to play.
This is a manageable injury. We have made incredible scientific advances in terms of understanding it. Kids can play the sport safely and effectively, but we have to have good programs in place.
How do you feel? Good. Any symptoms?
Good. New programs, new research, new hope, and a new way of thinking about concussions. It is just weeks before the start of his senior year of high school, and Patrick Haley and his mom are coming to see yet another doctor about Patrick's concussion.
The good news is the type of injury you have, and there's all the kinds of different concussions. You know, everyone's different with it.
For 3 years, Patrick has played running back for the Trinity High School Hillers in Washington, PA. He loves football, has played the game since he was in grade school, and was looking forward to a senior year on the gridiron. But Patrick is sidelined.
And you're going to see his left eye right there.
I see it.
Okay, see it? And now watch it when we get close. See it go?
Mm-hmm.
Okay. See his right one's working okay?
Mm-hmm.
Yeah, but then see his left eye? See how it's gotten worse?
Mickey Collins, a doctor at UPMC's sports medicine program, is seeing Patrick for the first time, and he knows what he's seeing.
There's no question in my mind this has been going on since the concussion, and there's no question in my mind this is from the concussion.
Patrick remembers the hit during a scrimmage at football camp last year.
It was your typical head-on-head hit. I had my head down, and I woke up the next morning. I couldn't stand the light. It was unbearable headaches.
Where am I? Come on.
Patrick went to the emergency room, was told to rest for a few days, and then returned to football a few weeks later. And then it happened again, another hard hit during a practice. This time he blacked out, and when he came to, he didn't know where he was. He stopped football for the season, but noticed something wasn't right.
I noticed that I had declined a bit, and I had to study a lot more, a lot harder. And nothing was coming to me as good as it used to. And then it just kind of slowly kept declining, and I was Pretty good student, yeah.
A's?
Oh, yeah.
Math A's?
Yeah.
And then after, what happened? Where did your grades end up?
A lot more B's. They were lower B's.
And did you feel like you had to work even harder just to get those
Yeah,
lower
I was
B's?
working a lot harder, yeah.
I can completely understand why you had a hard time with grades, why we see, and the symptoms you're always going to get from a convergence problem is fatigue and headaches right in the front of the head. I mean, you can't, it all goes together.
Yeah.
You know what I mean?
Patrick ended up here at UPMC after his family optometrist told him his left eye wasn't tracking properly. Dr. Collins confirmed that.
And you see his left eye is drifting off a little bit there.
Vision problems are common in concussion. It's why Patrick has been struggling.
You see, I want you to see his left eye.
2 concussions back to back were too much for his young brain. And the doctor's orders? No football for about 10 weeks to give his brain a chance to heal. What is a concussion anyway? The word translates from Latin meaning to shake violently.
Think about the brain as an egg yolk inside an eggshell, and we have 2 different forces that can result in the brain moving inside the skull. We actually have a stretching of the membrane of the neuron or the cell, and some neurochemicals that should be inside the cell get leaked out of the cell, which increases the demand for energy. At the same time, other chemicals leak into the cell, resulting in our blood vessels constricting. And so at the very time the brain's demanding more energy, we actually get reduced cerebral blood flow and hence less supply of energy.
In short, a concussion is a firestorm in the brain. Things go haywire and can cause a whole jumbled mess of problems. Doctors list 18 symptoms, including headache, visual problems, sensitivity to light and noise, nausea, dizziness, attention and memory problems, fogginess, fatigue, sleeping too much or too little, irritability, depression, and nervousness.
I am blown away by the numbers of kids that have this injury. And, you know, every day in clinic we'll see kids that fall off horses, off skateboards, off bikes, slip and fall and hit their head off the ice, football players, hockey players, cheerleaders. I saw a woman that got attacked by a chicken the other day. There's a lot of different ways to have a head injury.
The Centers for Disease Control says that every year as many as 3.5 million Americans suffer concussions, and every case is different. Some will have only a few symptoms and others will have many. But doctors know that the adolescent brain is different. Youngsters, like Patrick Haley, are slower to recover. Part of it has to do with brain chemistry, but another factor is neck strength.
Think about a woodpecker. You know, if you ever see what a woodpecker does, it slaps its head against a tree all day long. It's the only bird in the kingdom that has a bone that connects the base of its skull to its shoulder blades. It's called an occipital condyle, and the bone's there for a reason. And if you watch a woodpecker hit a tree, it's very acceleration, deceleration. The forces go right from the head through that little bone into the torso, supposedly. You know, and that's why we don't see concussions in woodpeckers. But the point I'm making is that when you have strong necks, it's going to mitigate the effects.
Go! Reload. Good, get out.
High school boys may not be drilling their noggins against trees, but their heads are in the game.
Hey, you gotta watch the ball. When the ball moves, let's go. Come on.
Doctors now know that the real danger comes when a player sustains a second concussion when he has not recovered from the first. It's called second impact syndrome, and fatalities are rare. More likely, a student athlete who sustains a second concussion when he's not recovered from the first will have more symptoms that will last longer. That's what happened to Patrick. Now he will sit out at least half of the football season. The promising news is that doctors say there's treatment.
The good news is we can treat this. We have very effective treatments for this, and I'll prove that to you.
And with time, Patrick will get better.
What position do you play?
I was a running back and linebacker.
You are a running back and linebacker. Okay? And you will be again.
I want you to rotate side to side with the head turn. So you're going to be following the ball as you rotate. And the same thing, we're monitoring for symptoms to see if you get dizzy, lightheaded.
This physical therapist is helping a patient to recover from a concussion.
So you'll start back here, and you're gonna walk.
Concussion often scrambles the vestibular system, the part of the brain that controls balance, and this exercise is helping to reset the brain. The therapy is part of the Concussions treatment program at UPMC's Sports Medicine Complex. The size of the program shows just how far the science of concussion has come. The entire UPMC concussion program used to be housed in this one room.
Go ahead. 1, 2, 3.
Now doctors and therapists see nearly 20,000 patients each year, many of them young athletes who have suffered a hit to the head. It's tricky because you can't see a concussion. Doctors must make decisions from outside, knowing that a young person's brain and cognitive function are at risk.
Imaging is not going to show this injury. So we don't have an MRI that shows this energy problem. We don't have a CT scan that shows it. That's not the tools that we utilize. I want to see you in about 3 to 4 weeks.
Mickey Collins is not a medical doctor, but a neuropsychologist. He tries to see what's going on with the brain without actually looking at it.
We have a physical exam that we do an examination where we can look at the patient's different systems of brain function, and we can see this if there's problems there. And we also know how to really look at the symptoms of this injury, and it all fits together into a puzzle.
Obviously, you need to rule out if there's any peripheral vestibular issues, which we do with more detailed vestibular evaluation.
In summer 2013, Pittsburgh was the site of a symposium on concussions.
That doesn't mean that I injure my brain.
This intense study of concussions is only 10 years old, and like any emerging science, it's moving along in a jagged line of advances and retreats as the research brings new layers of understanding.
We also are started collecting even more concussion data.
But experts from all over agree on a few things. Compared to adults, youngsters take longer to recover from concussions. Girls generally take longer to recover than boys do, and some sports are more concussion-prone than others. For boys, it's football, ice hockey, and wrestling in that order. And for girls, it's soccer, ice hockey, and cheerleading. And now, all those athletes have the opportunity to take a test that can help doctors identify any future concussion.
And then I need to discriminate whether it's in the exact same rotation. So in other words, this would be identical to this. This wouldn't be because it's rotated around. This is really hard.
Mark Lovell is showing us the test he developed. It's called IMPACT, and schools all over the world use it in their concussion management.
The first part of the test, they're going to be flashing words across the screen. And then they're going to later ask you, did we show you this word, yes or no?
Students take the test, measuring memory, attention, and focus to get a baseline of how their brain works on an average day. After a student has suffered a hit, he retakes the test.
Routinely, we'll see somebody who is at the 50th to 80th percentile on their baseline, and then they'll come in after they have a concussion and they'll drop to the first percentile. In other words, it drops that. It's pretty obvious when it happens.
From the small middle drop-down menu, you guys are going to put how many hours you slept?
As many as 90% of school districts in Western Pennsylvania use IMPACT or another baseline cognitive test. It can be a valuable tool, but it's not perfect.
We call it sandbagging. It doesn't happen very often, but sometimes kids will get the idea that if they do poorly on the baseline test, then it's going to be easier for them to get back on the field after an injury. So we've been aware of this for years. We've studied it, and we actually built in an index into IMPACT that catches people. And there have been a number of studies that showed that it catches people very well. In other words, it's really hard if somebody performs unrealistically poorly on the baseline, it's really hard to get away with.
Teenagers will be teenagers, competitive, sometimes reckless, seemingly invincible, driven to get back in the game. Doctors can feel that pressure from student athletes and sometimes their parents.
I'm very conservative when I deal with patients. If you hold somebody out a bit longer than they need to be held out, it's no big deal. If you put somebody back in too soon, that would keep me up at night, and I wouldn't be able to deal with that if I thought I was kind of just putting people back out there.
Do you remember being hit?
I do not remember. That was the big thing about my first concussion. We don't know exactly when I sustained it, and that's why it got so bad.
Madison MacDonald may not remember the hit, but she remembers the misery that followed. In 2009, after playing soccer on the Quaker Valley High School team all season, she got sick.
It was similar to flu symptoms. I was just always tired all the time. I wasn't myself personality-wise. I kind of didn't want to do anything. I lost interest in a lot of activities. It was hard for me to concentrate at school. I constantly had headaches. I always felt like I needed a nap.
I thought she had a brain tumor. I thought there was something wrong inside her head that was horrible.
Amy MacDonald watched her bright daughter dissolve into a teenager who didn't have the energy to get off the sofa.
We had gone to so many doctors, and the first question they ask is, did you bump your head? And when we said no, they did not go down any more discussion about a concussion.
Amy knew that Maddie had taken the impact baseline test and finally asked the school nurse to retest her. She failed. Maddie saw Dr. Collins at UPMC, and he confirmed she had suffered a concussion, probably followed by at least one more.
You would be very surprised as to how little it takes in some people. I often say that the mild injuries become severe and the severe injuries become mild. And it's because when you see a kid go down in the field and they lose consciousness and everyone takes a knee and they may even vomit on the field, we've actually shown that some of those symptoms predict quicker outcomes.
But the subtle hits, like the ones Maddie probably took, can be more troublesome because they can go untreated, putting the athlete at danger for another. Doctor's orders, total brain rest.
I was not allowed to text my friends, go on the computer, go see anybody. I wasn't allowed to do any schoolwork. I was told to sleep and eat and rest my brain completely.
Like a broken ankle or torn tendon, the injured brain needs time to heal. For Maddie, it was time off from school. Other young athletes can attend school, but with special accommodations.
The goal with accommodations is kind of two things. Reduce the cognitive work so that their concussion can recover as quickly as possible, and yet not let kids be punished or not let their grades and schoolwork decline because of this. And so it's all about a balance. We don't want to dismiss kids from work. We don't want to give them a pass. This isn't about getting kids off of work or out of their schoolwork. It's about getting them the education that they need to continue to go through, but yet letting the injury recover.
Maddie eventually received homeschooling and returned full-time the next fall. Patrick Haley has been attending school during his recovery with some extra classroom help.
Okay, so I need the full complement of offensive linemen.
He doesn't suit up for practice, but is on the sidelines every day, waiting to feel like himself again.
Go! Reload! Go!
Imagine being in charge of all of this.
If you don't get that sucker locked out, you can't shed it. Okay?
Not only are coaches under pressure to teach the game and to win it, they are increasingly responsible for the health of their athletes. And that means brain health.
The mission is if you come in on Monday and make the tackle and you tackle them above the waist and jump on like the rodeo, we're going to tell you whether you tackle or not. That's not what we want.
The problem of head injuries in football has brought national attention, with the NFL paying $750 million into a fund to help players who have suffered head trauma. High schools are ramping up their head game as well, with an eye toward prevention and management of concussions.
20 years ago, or 25 years ago, even 30 years ago, if you got your bell rung or you got a head rush or you got dinged, then you sat out for a play or two and you went back in. Now you get more and more people involved in things, involved in the mechanics of understanding this, and I don't think there's so much more or less concussions. I think there's more reporting of it. I think there's more recognition of it.
In 2012, the Pennsylvania General Assembly passed the Safety in Youth Sports Act. Under the law, a concussed player may not return to play until he has been cleared by a medical professional. And the law requires ongoing concussion education for coaches and trainers. Most schools have athletic trainers on the sidelines, and they know what to look for.
Headaches are common in football, and not every headache is a concussion. What you have to do is really go through your whole process of evaluating that kid and not just asking them, do you feel okay? Because that's not just everything, because every kid wants to play and every kid wants to get back out there. So you're going to be asking them, you know, tell me what you're feeling, or do you feel a little bit foggy? Do you have a headache? Are you dizzy at all?
They will lie. They will, not all of them, but many of them will. That's their competitive nature. What we see is if they run a play wrong, or if they're acting different, or they say something that doesn't really tie into the nature of what's going on at the time, we know that there's something.
Again. Coaches have long worked to prevent head injuries by teaching their players proper form.
There are two ways to bend when you play football. You bend at your waist or bend at your knees. Look what happens when I bend at my waist. Where's my head? Okay, so if I bend at my knees, what happens? I can keep my head up and hit with my breastplate, right?
And now the teams are getting help. North Hills football coach Pat CAREY is teaching his players how to keep their heads out of the game by using a new kind of practice system that provides visual cues.
There's actually thoughts on each side of that bag. And what we'll do is we'll give them verbal cues to make sure they get their head across the bag and use their eyes to see that bag. What your head does, your body does in tackling. So if you keep your eyes up and see that cue and run through with your body, we'll be able to keep the head out of the tackle more, which in our thoughts will help prevent some concussions.
That equipment is among many new products and technologies aimed at preventing concussions. Vendors at Pittsburgh's recent Concussion Symposium showed off their products, including a portable brain scanner, a balance testing system, and a special helmet sensor designed to measure the force of hits. The future of concussion management may lie partly in new technology, but some doctors are skeptical.
There will never be a concussion-proof helmet. Might we find a helmet that can mitigate the forces to some extent so it can slightly reduce the incidence and severity of the injury? Yeah, I hope so. There's very smart people working on that. But in terms of it, you know, preventing this injury from happening, because the brain's in fluid and it's moving in the side of the skull, I mean, unless we find a helmet that goes around the brain itself, you know, it's going to be really hard to prevent this injury from happening.
For now, though, the hope lies in identifying a concussion as soon as it happens and then treating it and keeping that young athlete safe.
What's your personal threshold as far as numbers of concussions?
I would say that if a person has 3 concussions in the same sport or 3 concussions within a 12-month period, I would have a very serious talk with them and their parents about throwing in the towel.
Have you had to have that talk?
A few times, yes.
What's it like?
Yeah, it's difficult. The kids are always the devil's advocate to me.
Other doctors, including those at UPMC, believe there is no prescribed limit, but that each patient and each concussion is different. If a player is healed, they will put him back in to play.
Have I had to retire patients from concussion? Of course I have. We're doing it less and less, though, because we have effective treatments for it. I can count on 2 hands last year how many kids I had to actually firmly retire from the sport, you know, so, and we see a lot of patients here. So the odds are very good that we can get kids back to play safely.
Patrick Haley never expected to spend his senior year watching from the sidelines. This was going to be his big year, but his concussions have reduced it to something less.
It's extremely frustrating. I mean, I'm always stressed out about it. I just can never get out of my mind. I just don't really know what to do.
What are you worried about?
Not becoming fully recovered.
Unfortunately, Pat was one of our returning senior leaders. He was a kid who never missed an off-season session. He was a kid that all of our players look up to and just a great human being. And to this point now, we're going into week 5 of the season. Patrick hasn't seen the field.
I'm going to refer him.
Patrick's doctors are confident that he will make a full recovery, but the experience has left Patrick and his mother with doubts about whether he'll ever return to football, even if he does get the all clear.
I don't really think that it's worth it. I would rather a quality of life for Patrick than have him experience the senior year of playing football. I don't think it's worth the risk.
If Dr. Collins clears him and he wants to go, do you feel like you have the final say in this?
I don't think I really have to, because I know that Patrick is intelligent enough to make the right decision.
Maddie MacDonald has come through the same challenges, and she is here to say she is fully recovered from her concussion.
I feel 100% okay. I feel normal. I don't really remember a lot of the time around the concussion or right before it about like what I was like, but I feel like I'm pretty much like the same person that I was before. Yeah.
And maybe that's the good news in this story.
There's different treatment and rehab with that as well.
Doctors say that despite the many risks, with proper treatment and rest, most youngsters do get better. All the talk about teenagers' brains brought up a question for each doctor about their own children. He comes to you as an 8-year-old and wants to play popular football or youth league football. What do you say?
So, you know, I'm okay with kids playing football, you know, and I'm okay if it's managed well. I don't think we should be doing Oklahoma drills every day, but I think we need to teach proper tackling. We need to teach kids about the injury and that it's not okay if you have a headache when you're hitting.
That as your aiming point, your target to get your head across. Here we go.
Sports is an incredible opportunity for children. Competition breeds a lot of benefit to children.
I do not think that you could put children in a bubble and prevent them from doing what they want to do. But what you can do is you can be proactive. You can educate yourself on recognizing the signs and symptoms of a concussion at home. Once it does happen, I think then the best thing you can do is get the best medical care that you are able to so that they are safely returned back to sport.
And if that student should decide not to return to the game, well, that's okay too. Because deep down we all know that even around here, there's more to life than sports.